How to use magnesium citrate safely for constipation and digestive health. Introduction: constipation is incredibly common. Almost everyone experiences it at some point. Whether it's caused by travel, changes in routine, certain medications, dehydration, pregnancy, under medical guidance, or simply not eating enough fiber, it can leave you feeling uncomfortable, bloated, and frustrated. One supplement that often comes up is magnesium citrate. But is it safe? How does it work? How much should you take? And is it something you should use every day? Today, we're going to answer those questions and explain how magnesium citrate fits into a wider approach to digestive health. Because healthy living for real people isn't about finding a quick fix. It's about understanding the cause of the problem and choosing the safest solution. Magnesium citrate is a form of magnesium in which magnesium is bound to citric acid. Many people take it as a magnesium supplement or because it can help relieve occasional constipation. It works differently from fiber supplements. Instead of adding bulk to stool, magnesium citrate helps draw water into the bowel. This softens the stool and can make it easier to pass. Because of this effect, it can also cause loose stools or diarrhea if too much is taken. Magnesium citrate may be appropriate for occasional constipation in some adults. Examples include traveling and changes in routine, temporary dietary changes, mild dehydration, reduced physical activity, occasional constipation after illness. It is not usually intended as a long-term daily solution unless advised by a healthcare professional. If constipation becomes persistent or keeps returning, it's important to identify the underlying cause rather than relying on supplements alone. Section 3. Don't ignore the basics. Before reaching for any supplement, ask yourself a few simple questions. Have I been drinking enough water, eating enough fiber, moving my body regularly, responding when I first felt the urge to go to the toilet? Sometimes constipation develops because modern life becomes so busy that we ignore our body's signals. Examples include a commuter skipping breakfast and sitting all day, a parent who forgets to drink water while looking after children, an office worker eating mostly convenience foods. Addressing these habits often supports digestive health in the long term. Always follow the instructions on the product label or the advice given by your healthcare professional or pharmacist. Different products contain different amounts of elemental magnesium, so the number of tablets or the dose can vary. General tips include: take it with a full glass of water unless instructed otherwise. Don't exceed the recommended dose. Be aware that it may cause loose stools if it upsets your stomach. Stop taking it and seek advice if needed. Remember, more is not better. Taking extra magnesium citrate won't necessarily work faster. It may simply increase the risk of diarrhea and dehydration. Like any supplement, magnesium citrate can cause side effects. The most common include diarrhea, stomach cramps, nausea, bloating. These effects are usually related to the way it works by drawing water into the bowel. If symptoms become severe, or you develop ongoing diarrhea, stop using the product and seek medical advice. Section 6. Who should be careful? Magnesium citrate isn't suitable for everyone. Speak with a healthcare professional before taking it if you have kidney disease, have severe abdominal pain, have unexplained rectal bleeding, have persistent vomiting, have inflammatory bowel disease, are pregnant or breastfeeding, are taking medicines that may interact with magnesium. Magnesium can also reduce the absorption of certain medicines, including some antibiotics and thyroid medications. Your pharmacist can advise you on how to space doses if needed. Constipation is often temporary. However, you should seek medical advice if you experience constipation lasting several weeks, severe abdominal pain, blood in your stool, unexplained weight loss, persistent vomiting constipation, alternating with diarrhea constipation that keeps returning despite healthy lifestyle changes. These symptoms deserve professional assessment to rule out underlying medical conditions. Don't simply keep increasing laxatives or supplements without finding out why it's happening. If your goal is healthier digestion over months and years, think beyond supplements. Healthy bowel habits often include eating more fiber. Foods such as oats, beans, lentils, vegetables, fruit, Whole grains help support regular bowel movements. Drinking enough fluids. Fiber works best when your body has enough water. Regular physical activity. Walking, gardening, swimming, and strength training all help keep the body moving, including the digestive system. Responding to your body, ignoring the urge to open your bowels regularly, can sometimes contribute to constipation. Listening to your body matters. For some people, magnesium citrate may provide short-term relief from occasional constipation. For others, a different treatment, or simply improving hydration, fiber intake, and movement, may be more appropriate. The key question isn't, what's the strongest supplement? It's, what's causing my constipation? Treating the cause often provides better long-term results than repeatedly treating the symptom. Magnesium citrate can be a useful option for some people experiencing occasional constipation. It works by drawing water into the bowel, helping soften stools and make them easier to pass. However, it's not intended to replace healthy habits or ongoing medical care. Supporting digestive health usually involves eating enough fiber, staying hydrated, moving regularly, understanding what's causing the problem, and seeking medical advice when symptoms are persistent or concerning. Because healthy living for real people isn't about relying on one supplement. It's about building habits that support your health for years to come. If you want magnesium citrate supplements, fiber-rich recipe books, water bottles, meal prep containers, digestive health resources, and healthy lifestyle tools, I've added useful suggestions in the description. Like and subscribe if you found this video useful.